It's a Boulder energy. It tends to be very natural. It tends to be very focused on a natural appearance. We're not trying to change the way people look. We're trying to freshen up the way people look. We don't want any of our patients to be walking down the street and it all appear like they've had anything done.
I came to Boulder in 1984. I always wanted to live in Colorado and always wanted to do plastic surgery.
I've been a board-certified plastic surgeon now for about 11 years. Between myself and Dr. Kusley, we've been practicing plastic surgery for about 40 years.
I'm a problem solver, and when I see someone, whether it's from a cosmetic standpoint or a reconstructive standpoint, I look at them and try to visualize an end result.
I got into plastic surgery when my mother was diagnosed with breast cancer. I was in college and her plastic surgeon really had a profound impact on our family and on her recovery, and I saw what a tremendous impact that a plastic surgeon could have in that regard.
We look at the raw material, we look at patient desires. Obviously everybody has a different idea of what their ideal outcome would be.
We really spend a lot of our time listening before we ever discuss a procedure, before we ever even do an exam, to try to figure out exactly what's driving a patient to come into our practice. What we believe is that every patient is an individual and no one is ever treated exactly the same way, because no problem, be it a reconstructive problem or an aesthetic or cosmetic problem, is exactly the same. Our practice is divided basically into reconstructive and cosmetic surgery, and we do practice about half and half. Most of our reconstructive surgery is based around breast cancer and skin cancer. Most of our cosmetic surgery is divided either into mommy makeovers, tummy tucks, breast lifts, breast augmentations, or facial rejuvenation. Facelifts, upper lid operations, things to make the face look younger and healthier. Four Seasons is designed to provide medical peels, medical skin care, laser resurfacing. We treat pigment, we treat redness, all types of conditions of the skin to help improve someone's appearance with or without surgery. With any kind of facial rejuvenation, there needs to be a foundation of skin care that you build on. There's not any operation that you can do to the face that doesn't do better and doesn't last longer if you take care of it. And a lot of that has to do with the quality of your skin and how well you maintain it. It's not what's done in the operating room necessarily, but what's done in the operating room in conjunction with what people can do at home.
I would say breast augmentation I've probably done between 2,000 and 2,500 over the last 25 years. Breast surgery in general, probably twice that, with reconstruction and reduction and the various other breast procedures that we do.
Botox and fillers are products that we use in the non-surgical realm at Boulder Plastic Surgery to help people look young, treat the signs and symptoms of aging in a more cost-effective and less downtime environment. Now, the biggest take-home reward that we get is the smiles that we see on people's faces. And some of it is dealing with a crisis situation like a cancer diagnosis, and some of it is just restoring a body that was ravaged by childbirth, for lack of a better term.
Do you love what you do?
I do. Always have. Probably will until I retire, which is not in the near future.